Welcome to the WellMed Charitable Foundation's Caregiver Teleconnection session entitled Caring for Someone with Mental Health Issues, presented by our expert speakers, Dr. Elliot Sklar and Lucy Barylak. It is my privilege to introduce you to Dr. Elliot and Lucy, and I will begin with Dr. Elliot Sklar, who's a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually, and his research is focused on the complexity of issues related to aging and caregiving. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida, and he publishes and presents his work internationally. He recently presented at the American Society on Aging meeting on our Caregiver Teleconnection program. Dr. Elliot, thank you so much for joining us today. And now I will introduce you to Lucy. Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association and awarded on the basis her dedication in developing a national coalition to support the issues and challenges facing informal caregivers and their involvement in the delivery of home care across Canada. Lucy provides ongoing programming to support the needs of caregivers across the United States through the WellMed Charitable Foundation's Caregiver Teleconnection program. She has presented her research and showcased innovative programming that she has developed at conferences across North America. Lucy and Dr. Elliot Sklar, thank you for joining us this morning.
Thank you so much.
Thank you, Gloria. Good morning, everybody, and welcome. I hope everyone is feeling well. You know, for the past few years, Elliot and I have been saying that we are all facing 2 pandemics. One is the virus, and the other is the rise of mental health issues that many people are experiencing. Elliot's going to talk a little bit more about that later on in our session. So let's talk about what is mental illness. Also called mental health disorders, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behavior. One of the first challenges many caregivers and patients experience can be diagnosis, and many patients are reluctant to seek care. There's still a strong stigma around mental health in our society, and many people are afraid to get help. So the first thing is to, you need to get a good diagnosis. So how is diagnosis done? So let's look at it. Obviously, if you're feeling any of these symptoms or you see that in your loved one, you need to go to the doctor. At first, there will be a physical exam. Your doctor will try to rule out any physical problems that could cause your symptoms. There'll be lab tests. There's many, including, for example, a check for your thyroid functioning or a screening for alcohol or drugs. And obviously a psychological evaluation. A doctor or mental health professional talks to you about your symptoms, thoughts, feelings, and behavior patterns. You may be asked to fill out a questionnaire to help answer these questions. You know, sometimes it's difficult to find out which mental illness may be causing your symptom, but taking the time and effort to get an accurate diagnosis will help determine the appropriate treatment. This is really important to keep in mind. The more information you have, the more you'll be prepared to work with your medical health professional in understanding what your symptoms may represent. And this is also true if you're a caregiver to someone experiencing mental health. It's just as important for an older person with symptoms of depression to seek treatment as it is for someone younger. The impact of depression on health in older adults can be severe. There's been a lot of research around this topic that says that depression is associated with worse health in people with conditions like heart disease, diabetes, and stroke. Depression can complicate the treatment of these conditions, including making it more difficult for someone to care for her or him, and to seek treatment when needed. In older adults, depression may be disregarded as frailty, or it may be viewed as, a result of life changes, chronic illness, and disabilities. So sometimes we don't pick up that this person is really depressed. So recognizing the signs and seeing a healthcare practitioner is the first step to getting treatment, which can make a real difference in someone's quality of life.
Very, very true. And I think many of us have experienced firsthand at certain points during our experience of the pandemic what it feels like to feel down or to feel hopeless. Many of us have certainly gone through good times and not so good times. And certainly one of the effects of the pandemic has been the effect on mental health. Now, many individuals were already experiencing depression and anxiety before the pandemic. And at that point, there was an estimated 9.5% of Americans using mental health services in 2019. The pandemic most likely made these things worse. People are often surprised to learn that the rates of mental health disorders are rising fastest, actually, among baby boomers. It's estimated that about 20% of people aged 55 or older experience some type of mental health issue, and the number of older adults with depression is expected to double between 2010 and 2030. So we're almost right in the midpoint there. We go through a lot of changes as we get older, and a lot of experiences like losing loved ones, experiencing medical problems, even retirement. All of those things can make people feel uneasy, stressed, or sad. And social isolation, or the stress of acting as a caregiver, can also very much negatively impact older adults' mental health. It's normal to go through adjustment periods when you have this kind of life event, but it's important to know if these feelings persist and if they begin interfering with daily function. That's really, really key. So then it might be a signal that it's time to seek treatment needed to feel better. But one of the problems is that a lot of older adults are hesitant to reach out because of the persistent stigma around mental health issues and generational differences in how these disorders were perceived. So if you think about someone's life course experience, if you were born, let's say, in the 40s, in the 60s, mental health was dealt with very differently as that person might have been growing up than it is today. And the range of treatment options through the lifespan has also evolved. So these are important things to consider. Now, for our presentation today, we used a more broad term, mental health issues, because caring for someone with mental illness can really vary. You may know someone who's being treated for depression and usually seems fine, but they might be going through a depressive episode. And for other people suffering from depression, their experience could be very different. You might notice a change in mood or affect of a loved one during the course of the pandemic. Another hallmark of people who experience mental health issues is cycling on and off of medications, which can also be a wild ride for that person and all of those around that person. I like to sort of think of anxiety and depression in a way like allergies. I know that they're different, but it's an analogy for me. Sometimes pollen can really trigger my allergies, and then I need medication and eye drops. I need to have water with me. And then other times I'm fine. For other people, their allergies might be more severe and consistent, like people with asthma who are allergic to dust, which is pretty much all around us. So that analogy helps to remind me that during more stressful times, someone who suffers from anxiety and depression might have more challenge in getting through and through coping. Now, sometimes the inverse is true, and people who are depressed have a harder time coping during times of the year when we often think of celebrations like Christmas or New Year's. So it can certainly be very challenging to love and to care for someone with mental health issues because of the challenges that are inherent to mental illness. For example, a bad knee might impact someone's mobility, but poor mental health can affect everything, including a person's desire to even be mobile. So if you think about it, many caregivers themselves have had periods of challenge, and as a result, that has impacted relationships around the caregiver. I know of some caregivers who've used, for example, alcohol to cope and then had other impacts upon their relationships. One of the most difficult things I think about mental health is the stigma. We talked a little bit ahead of the hour about that. Many people see mental illness and mental health issues as a weakness or as a failure or even a lack of motivation. That needs to change, especially as some CDC reports prevalence of mental illness among seniors in the US to be at about 20%. And some World Health Organization reports estimate that worldwide prevalence is about 15%. One of the most alarming statistics to me is that about 58% of older adults who die by suicide have seen their primary care practitioner in the last month of their life, which means that PCPs are not attuned to mental health of their older patients. If you've watched the news recently, you may have seen that we lost a national treasure, Naomi Judd. Now, before her death, the country music icon had been very open about her experiences with mental health issues, particularly depression and suicidal ideation. Judd's daughters attributed her passing to what they called the disease of mental illness. Now, Judd's death to me is a very somber reminder that mental health issues can affect anyone. And some elderly adults may face uniquely high risks for developing a mental illness like depression. Part of that is due to the link between health conditions and depression. People who have chronic health issues, like Lucy was mentioning, diabetes, heart disease, or chronic pain as well, might be also more likely to have mental health conditions. Older adults tend to have more health concerns, with at least 80% dealing with at least one chronic health condition, according to the CDC. Now, there certainly are effective treatments out there, but sometimes it takes a very honest conversation for people to get the help that they need and deserve because of those stigma issues that we were talking about, especially generationally among older adults. So I was hoping for this to be a good time, perhaps, for a little open and honest discussion if anyone wants to participate. Does anyone have any comments or anything that they would like to share or any particular experiences? You can go ahead and unmute your mic if you're on Zoom. I believe if you are participating by phone, you can press *6. Anyone have any comments or questions, any experiences that they want to share? You can also use the chat box.
I apologize for that. I guess what I want to say, though, is that working in the health professions for so many years, one of the things that is so important is for healthcare workers to really be aware what you were saying, Elliot, that sometimes seniors can be, I don't know what's going on here, but hold on.
Question. How can you tell the difference between a mental health issue and a senior moment? Something that that would be, I can't think of the word, attributed to dementia or something like that. How can you tell the difference?
Consistency. If there's a pattern, if the behavior or the lack of memory, for example, what is the symptom that you're describing, if I may ask?
Mostly it would be frustration with not being able to remember directions to someone's house or appointments, things that are scheduled, not being comfortable with some of that memory loss.
So I would say it's really an issue of consistency. And I apologize for the issues that we're having. If this is something that's going on for more than about a month to 2 months, then I would say that it's time to certainly have a discussion with a provider, especially in the case of early stages, for example, of dementia and Alzheimer's. There are medications that can slow the progression. So this is a very critical time to sort of catch those things and be able to discuss that with a provider.
Okay, so the answer to it is, as you said before, go to your medical practitioner and let them do the test to determine if it's a physical illness or a mental illness.
Absolutely, and there are certainly memory tests that providers have or could recommend. But my answer would really be in distinguishing the difference between something that might be transient or something that might be more longer lasting would be the duration of time that you're seeing those symptoms. So I would say if it's been more than a couple of weeks, definitely reach out to a provider. There's no harm. Better safe than sorry.
So I apologize for that. It was a bit of a family emergency. They had to get in touch with me, but all is well.
Sorry.
Okay. All right.
Elliot, I have a quick question.
Certainly.
Well, it's probably not quick, but so my father has diagnosed dementia. He's also diagnosed bipolar. You know, he's got a little jar of issues. The problem that we're running into as far as like his mental health lately is he is not quite deemed that he can't live alone by himself anymore, but he is a harm to himself living alone. And it's been a real struggle to get with the social worker. There's like such that gray area where his family knows he needs like assisted living, but it's not quite legal for us to force him out of his house. And it's all mental health. He's a huge threat to himself because he's 70 and lives alone. Do you have any like advice or maybe a pathway that I haven't, maybe most people don't know about? Like, the gray area I'm talking about where they're not quite crazy yet, but they're crazy enough where they can't live alone. And it's so hard to manage his mental health without legality. I can't, force him to live in assisted living yet.
Correct. That is correct. Have you reached out to your local AAA?
Oh, no, AAA.
Okay.
No.
So your local area agency on aging would be your first stop. You can locate them actually by looking on Google or calling 211.
Okay.
211 in any community will have resources for you that might be able to assist. You may want to call 211 actually so that you
Okay.
can ask them for the contact for AAA. But also if there are any other resources for mental health in your community, particularly for seniors. This is a very challenging issue and one that I'm extremely sensitive to. I have a friend who's dealing with a very similar issue with her mom who has mental health issues, and it's been extremely challenging. The only resource that was able to really assist her in her community was through her AAA.
Amazing. Okay.
So I would recommend that. And Laura, you have your hand up. I'm not sure if you have something you want to add.
Yeah, I have another question when you're done with this one.
Sure. Lucy, do you have any other suggestions or anything that you might want to add?
No, I think that what you're saying is the right thing to do. I will be talking a little bit more about the approach that you should be taking with people who are suffering from mental health, because a lot of them really are afraid to get help. But I will go into that a little bit more. But Laura, go ahead and ask your question.
All right, I have a question. My dad's been struggling with anxiety and depression for about 2 years now. and it's real severe. Like he doesn't want to leave the house, and he's lost a lot of weight. He's malnourished, doesn't want to eat. But when we try to like talk with him about, hey, let's try this way of helping you, let's try that way of helping you, he just says no, 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 no. So I've tried to make appointments with him. Insomnia is another big issue of his. So I tried to make an appointment with an insomnia doctor, and basically he said, if your dad refuses to come, don't bring him, because he won't participate in anything that we do. And my mom passed away at the beginning of this 2 years ago, and I think that's what put him into this downward spin. But he's currently not taking any meds because the nurse practitioner that he sees has tried him on every med possible, and she just says, well, if they're not working, just stop taking them. So I guess I'm looking for some advice there.
You know, unfortunately, as long as a person is mentally competent, there's very little that anyone can do. And the only thing I can say to you is to be patient, to reassure. You're doing exactly what you should be doing by getting information about what is mental health issues. There's support out there to let him know that you care about him, that you're concerned about him. And unfortunately, many times, the only time that people who are cognitively alert is when a crisis happens. And then, and then things kind of take a little bit of a turn. But unless, Elliot, you have with any magic formula, that's about all you can do. And try to be patient. I know it can be very frustrating. And you're afraid. I get it. I mean, we've all dealt with someone in our own family with mental health, and you feel like, oh my God, I can't do anything. So being kind, being supportive. The only thing is, as long as he's not harmful to himself. My concern is what you said, that he's not eating, and it'll just have to take its course. I'm sorry. That's about all we can tell you at this point.
Okay,
Laura,
thank you.
Laura, have you reached out to your local AAA?
I reached out to the Department of Senior or something or other, and they sent a social worker out to go talk with him, and he told the guy, go away and don't come back, leave me alone.
So you might want to reach out to your local AAA. I was going to suggest having a social worker come to the home and seeing if your dad might be open to speaking with him or her. But you might want to have the opportunity to share a little bit more with your local AAA office, with the social worker there, what's been going on. Sometimes they have magical ways that they can assign certain people that have woo and that seem to have a better effect in connecting with people. So I would say try every avenue possible. Again, 211 is a great resource in your community, and see if there are any local mental health agencies or organizations whose focus is on seniors. Is your dad open to taking walks with you?
Nope, he won't go outside. He doesn't even want to go out to get the mail.
Okay.
He won't do anything. The only thing he'll do is drive to the dump when the trash smells.
So it sounds like his depression is pretty severe in terms of his lack of motivation to want to do things. And that's what I was talking about before, whereas a knee problem might limit your mobility, mental health issues can, limit your motivation to even be mobile. So I would try with every free resource in your community to get as many different social workers into your home and see if maybe one connects with him. You might want to take a less direct approach, for example, and invite someone into the home to just be having a conversation with you that might then include him, so that it doesn't seem like directly. But speak with your local AAA and any organizations in your community that may be able to send someone out.
Okay, thank you.
Of course. We also, sorry, just one quick thing. We will be sharing our presentation slides, and we have a bunch of resources at the end as well. You might want to reach out to some of those as well.
Okay, so while I was running to get my phone, my screen kind of went off. I could still see myself, but I can't see any of the slides. but we'll continue. You know, this may be repetitive for some of you, but it's important to discuss and define mental illness and the types of mental illness we're discussing today. There's so many of them, so let's look at that. You know, the defining symptom for each mental illness are detailed in a diagnostic and statistical manual of mental disorder called the DSM-5. Now, it's really a book. It's a huge, big manual, and this manual has been published by the American Psychiatric Association. This manual is used by mental health professionals to diagnose mental conditions and by insurance companies to reimburse for treatment. So one of the challenges in these diagnoses often don't have the kinds of tests we do, for example, for cholesterol. You go and you get a test and you know you have cholesterol. There's no blood test at the present to measure depression. That can make diagnosis and treatment challenging, since it's up to the patient to be very frank and honest when disclosing symptoms, and up to the provider to use their expertise and judgments to do a good and proper diagnosis. So it's very important to seek a healthcare provider that is experienced in dealing with mental health issues. It's really key. So the main, causes of mental illness relevant for our program today. So we're going to look at the ones that we're kind of focusing on. So there's depressive disorders. So what are they? These include disorders that affect how you feel emotionally, such as the level of sadness and happiness, and they can disrupt your ability to function. And then there's anxiety disorder. Anxiety is an emotion characterized by an anticipation of future danger or misfortune, along with excessive worrying. You're constantly worrying. It can include behavior aimed at avoiding situations that cause anxiety. This class includes personalized anxiety disorder, generalized anxiety disorder, panic disorder, and phobias. Now, there's trauma and stress-related disorders. These are adjustment disorders in which a person has trouble coping during or after a stress life event. For example, it includes post-traumatic stress disorder, PTSD, and acute stress disorder. Now, substance-related and addiction disorders are considered also as mental health issues. These include problems associated with extensive use of alcohol, coffee, tobacco, and drugs. This class also includes gambling disorder, and I have to say sexual addiction could be there as well, eating disorder, and believe it or not, even excessive shopping, okay? And hoarding. Hoarding is a big one as well. So let's look at what are neurocognitive disorders. Neurocognitive disorders affect your ability to think and reason. They are acquired rather than developmental. Cognitive problems include delirium, as well as neurocognitive disorders due to conditions or disease such as traumatic brain injury or Alzheimer's or any other cognitive disease. Personality disorder is another one. A personality disorder involves a lasting pattern of emotional instability and unhealthy behavior that causes problems in your life and in your relationship. Examples include borderline, antisocial, and narcissistic personality disorders. There are many more types of mental illness, but we thought it was important to outline the key disorders we will be discussing today. So, sometimes people just throw out this, that he's narcissistic, he's this, he's that. We have to be very careful when labeling people. That's why it's so important to get a proper diagnosis and not label an individual. And sometimes we put them in their charts, and we have to be extremely careful about that.
That's very true. The same goes, I think, for how we label ourselves. As I'm listening to you talking about addictions and coffee, and I'm on my fourth coffee, and Amazon and FedEx are here delivering all the things that I bought online recently. So, but in all truth, though, one of the questions we had earlier is, how do you know when one of these mental health issues or disorders is really is such, and not just something that's more transient. And I think it really has a lot to do with interference in your normal ability to function, and also how long these symptoms are lasting. But there certainly are treatments. There's no cure for mental illness, but there are a lot of treatments. And treatment really does depend on the type of mental illness with which one is diagnosed, how severe it is, and also how you are able to work with that course of treatment. Because in many cases, a combination of treatment works best, including therapy. If you have a mild mental illness with well-controlled symptoms, treatment from a primary care provider could be sufficient. However, a team approach is usually much better to make sure that all medical and mental health needs are met. And I think it's very true, especially for severe mental illness like schizophrenia, for example. And that team of providers might also include people you wouldn't normally think, like a pharmacist. But a pharmacist can be key in helping to manage some symptoms and also make recommendations. One of the reasons why a lot of people don't stick with treatment or cycle on and off of medication is because of symptoms. For example, weight gain, and people don't like that. So let us talk a little bit about treatment further. There are different kinds of treatments, and although psychiatric medication, as I said, doesn't cure mental illness, it can significantly improve symptoms. I am not a personal believer in suffering. So I'm a big believer in some of these medications. For example, if you are diagnosed with anxiety disorder, a short-acting tranquilizer, for example, can be very helpful. So it's very important to speak with your doctor about what you're experiencing honestly, because for a lot of people, they do speak with their doctors about anxiety or panic attacks. And first thing that a doctor will say, most likely, is to try breathing. And that is wonderful. But for some people for whom there is a more significant mental health issue, that might not work, especially in a crisis moment. So we certainly have a lot of antidepressants on the market. And if you watch TV and you see commercials, you will probably see a lot of ads for different antidepressants and different antidepressant boosters right now, which are very popular. They can certainly help to improve symptoms like sadness, hopelessness, lack of energy or motivation to do things. And now antidepressants are also not addictive. They do not cause dependency, which is sometimes a concern that people have. But as I mentioned, it can be hard to get people to want to go on them and stay on them. There are anti-anxiety medications, like I said, used to treat anxiety disorders, which can include generalized anxiety disorder or panic disorder, but they can also help to reduce agitation and also can help with insomnia. There are also long-term anti-anxiety drugs that can include antidepressants that also work on anxiety. Lots of options. Mood stabilizing medications are another class of drugs for things like bipolar, and they can help to treat symptoms of alternating mania and depression. There are also antipsychotic medications for psychotic disorders such as schizophrenia, but they're sometimes used to treat bipolar or even for depression. A key here is that all of these medications work a little bit differently with our older adults than they do with younger adults. So it's very important to speak with your doctor to make sure that your doctor perhaps can refer you to a psychiatrist or your loved one if needed that might specialize in geriatric psychiatry. Depending on where you live, it's very hard to come by those specialists. But as I said, it's helpful because medication can be very helpful, but when you're dealing with an older adult population, they sometimes have different effects than they do on younger adults. And it's important to find providers that have that level of experience. Now, as caregivers also to people suffering from mental illness, we also need to recognize that these medications can be wonderful, but they have adjustment periods. And some of them can include some pretty bad side effects: insomnia, agitation, ironically enough, all of the things that they might be used to treat. We don't know exactly how some of these medications work. That's why there is this adjustment period, but they can impact even sexual function and weight. So it's very important to try to be sensitive to that when you're caring for someone who might be adjusting to a kind of medication. I thought this might be a good time to ask if anyone has any questions or any comments or anything that they want to share.
That is really good information about medication. I'm just really glad that you shared that. Thank you. That's a big deal for me.
Absolutely, and that's why learning about the diagnosis is so important so that you can become more familiar with what treatment options might exist to speak with about your provider. Anyone else? All right.
Okay. You know, this is especially why learning about the illness can help you understand how it affects the person you care for and might make you feel more confident caring for them. Because there are, as Elliot said, there are side effects and people definitely need to stay on their medications. You can learn about the illness by going to support groups or services. You can meet others who may have been through similar experience and get support and information. It can also be a safe place to express anger and resentment, which is also a goal of our program today. I know we haven't focused a lot about it, but I have to tell you, it's not easy dealing with someone with mental health issues. You can become very angry and resentment. It can be hard to care for someone, as I said, it can impact your relationship with that person as well. So the question is, how do I give emotional support to a person I care for? It's very important to offer to listen to the person you are supporting. Listening to someone doesn't mean you have to say much back to them or come up with solutions to their issues. I know that's hard to kind of accept, because when somebody is sharing their problems or they're unhappy, the first thing you want to do is come up with a solution for them, because then you feel that otherwise, what's the point? But I have to tell you that sometimes they may find it helpful to just talk to you about their problems and to know that you are there to listen. So listening is an amazing skill that's so important when dealing with people with mental issues. So don't be afraid to ask them questions about how they're feeling and listen to their answers. So hopefully they'll tell you. If they aren't feeling great, and if you can do anything to help, you make sure you don't take on too much. You can ask them, how can I help you? Is there something that I can do to make it better? You know that they need help. That's the thing. You're sort of reassuring them. So how do I encourage the person I care for to get treatment? A lot of people with mental health do not want to get treatment. You might find that the person you are supporting doesn't want to. This might be because they don't think they need help. And things will get better on their own, just very much like, I think it was Laura who kind of talked about her father. They don't think treatment will work. They don't understand that they are unwell. They're scared of what will happen to them if they tell their doctor how they feel. They could be ashamed. They're worried what other people might think. They're worried if it will affect their job or their studies. They feel helpless. They're reluctant because of past experience within the healthcare system. So important to remember that. And so it's easy to blame, but if you could just keep those statements that I made in mind and ask them, why do you not want to go and get some help? So it's important. If the person you care for doesn't want to get help, it can be very frustrating, as I said. So what can you do? Again, we're going to review it. Talk to them about how they feel. Ask them why they don't want to get help. Explain that you are worried because they seem upset, down, stressed, worried, and you want to try to help them. You can tell them that you love them and you care about them. Be very sympathetic. And that there is help out there. So it's important for you to educate yourself about what help is available in your community. Very much what Elliot said. Find out what your local areas have in regards to supporting someone with mental health issues. And then you can go back to them and explain what kind of help they can get and ask them if they would be willing to at least try. Offer to help them talk to their doctor, or offer to talk to their doctor before their appointment, if that's the first step you want to, with their permission, obviously. Some people might refuse to get help even if you try to support them. It's important not to give up and to stay hopeful. It might take a while before they get help. Many times, as I said before, they need to get to a crisis before they accept help. In the meantime, get the support you need to deal with these difficult times. You really should be there. You really need as much support as they might at that particular time. And I know that Elliot's going to be talking about how important it is to have a plan in place regarding if the person becomes emotionally and physically abusive towards yourself, or they might be at harm to themselves. So, does anyone have any questions or any experience to share? Has it been hard for you or a loved one to get the help that you need? I have to say that all those calls that I just got, is somebody put their hand up? Angela? No? All those calls that I got was from a friend who was having a crisis situation with a mother who has mental health issues and was out of control. So having apologized, I will get back to her. But and the first thing that I said to her, remember we made a plan. I'm sorry, I know I was the first person to contact. I'm on a Zoom meeting, and so she was able to go and get the next person in line. So having a plan is extremely important.
All right. Well, in the interest of time, I will continue. I know that we often have a lot of healthcare workers who participate in our programs. We have some additional tips for you on how to broach the subject of mental illness or concern with patients, but these may also be very useful for our caregivers today. So it's important to show that you're concerned in a way that is not judgmental or confrontational. For example, you seem blue, or it upsets me to see you this way. How can I help? What can I do to help you feel better? Keep questions really simple. And I have a snapshot here of the Patient Health Questionnaire, the PHQ-9. It's a series of 9 questions that is free on the internet. It can be helpful in guiding what kinds of questions to ask and how to gauge where someone might be at mentally. Always really important to offer reassurance and hope and let people know that you're certainly not alone, that you're there to support them however you can. And really try to avoid phrases that sound dismissive or accusatory. And Lucy, as you had mentioned, it can be really hard when you're dealing with someone who is suffering from mental illness to not feel frustrated or aggravated or agitated. But that's why it's so important to remember that what you're experiencing, what you're responding to, are those symptoms of mental illness. And one really great tip, especially for some of the questions we received today, when reaching out to 211, see if there is a local recovery support or resource group for mental illness or depression. Reach out to that group. They may have some local resources or some ideas or tips as well. One huge thing that I want everyone to consider is that there are a lot of generational, but also cultural barriers that exist when people are trying to seek out mental health services or might be resistant to it. Mental health stigma and access to care can certainly be very different in different communities. A great example is that African Americans and Hispanic Americans use mental health services at about half the rate of Caucasian Americans, and Asian Americans at only about 1/3 the rate. So we need to remember as well that there might be some cultural nuance. And it's so important to keep checking in regularly. You know, I'm a professor, I have a student who's been going through some issues. I always, every 2 weeks, just send an email to let him know, even though I'm not teaching him anymore, how can I help? What can I do? How are you doing? Checking in, I think, is really, really important. And we do have some other tips as well that we'll share, as well as the resource for the National Alliance on Mental Illness. We have their website at the bottom there and a helpline that you can call for additional resources. I do see that we have someone with a hand up. So if you have a question or a comment, please go ahead.
Hey, thank you. In general, just looking over these tips, these are good tips as far as like keeping the questions simple. With, I guess, an elder who is suffering from dementia or Alzheimer's, would you recommend that we, when we talk to them and keep it simple, would you recommend that we ask open-ended questions, or should we phrase the questions like, should we help them so that their answers are simple, or are they still able to formulate if we ask them an open-ended question, you know, are they cognitively able to process all that?
That's a great, great, great question. And I'm sure, Lucy, you probably have some input here as well. But one of the programs that we do includes a little 101 on communication with people with Alzheimer's and dementia. And having close-ended questions is much preferable to open-ended questions.
Gotcha. Okay.
It helps to keep things simple and to give people choices in terms of response.
Okay.
But you may want to start out with an open-ended question and see where that may take you.
Just kind of gauge it. Okay.
Exactly. Lucy, what do you think?
I think that you answered it absolutely the way I would have. Thank you.
Thank you. That's helpful. Thank you.
Of course. And remember as well, medications, psychotropic medications affect people with Alzheimer's and dementia very, very differently. And that needs to be considered as part of any type of consideration for medical treatment.
I think just it's so important to also keep in mind if for any reason your loved one or a senior has changed medication, or even over-the-counter medications, pain pills or sleeping pills can really have an adverse effect on that person. And they could be displaying signs that you think are, you know, cognitively impairment, but it's really very important to keep that in mind and always make sure with the doctor and the pharmacist before buying anything over the counter.
Absolutely. So I see that we have about 10 minutes left in the hour. I know, Gloria, I'm sure you're probably going to have some end of session housekeeping. Lucy, is it okay if I breeze through the rest of our presentation so that I can make sure to include what we prepared about how to deal with a crisis?
Absolutely.
All right. So first thing, very, very important, ahead of a crisis, crises are less likely to happen if you are in better health as a caregiver, mentally and physically, to be prepared to deal with crisis. So when you are caring for someone who is experiencing mental health issues, please, please, please be sure to care for your own mental and physical health. It is so important to know what you can and cannot do. And for some of us, the cannot is actually motivating someone to get the help that they need. And that can be very difficult to accept. It's also hard to see people who are suffering. So it's really, really important to keep an eye on your own health, to know when you need a break, to remember that we're not pizza, we can't make everyone happy, and to set up boundaries. Boundaries, 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 so important. It's really important that you know how much you're willing to do and how much you want to do and how much you can do. And it's okay to talk with the person that you're providing care to about boundaries together. For example, if the person is reluctant to get help, there may be a boundary that you set in place of not speaking to them as frequently if it affects you negatively. That sometimes unfortunately happens in relationships. So it's very important that you're mindful of how you're feeling and how you're receiving that person's energy. For me, I talk about exercise all the time. It is one of the few things that is found in meta-analyses, which is the largest clinical trials to really help to bring happiness and to relieve stress. So we talked a little bit about crisis situations. And before we ended, I wanted to be sure to include this. How can you deal with a crisis? Well, it's so important to plan however you can. Know who you will contact in case of an emergency, just like Lucy was someone's today. Make a personal plan which has some information about signs of what a crisis might look like and what you would do if something happens. They can be very different for different people in different scenarios. So speak with your healthcare provider too if you're concerned about your loved one. Remember, you can always call 911. If there is no immediate urgency, Gloria shared SAMHSA's contact information, which is included here in our slides as well. They have services in English and in Spanish. And I want to share with everyone also that we have a link here, a hyperlink for online treatment locator. And you can also text to the number here, help for you. And starting in July, there is a new number that we will all have access to, which is specific for mental health. And that number is 988. So I'm very pleased that that will go live on all devices on July 16th. Important to keep in mind that these are some excellent resources that we will also be sharing after our program today. I'm going to run through here to the other resources that we have. Wanted to ask if anyone had any last questions or comments, and then we will hand it back over to you, Gloria. Laura, did you have a question or a comment? No? Anyone else?
Elliot, is the new wait, what did you say the number was? It was
Not 988.
988. Yes.
It goes live on July 16th. Yes, I'm sorry.
No, that's okay. That's amazing. I didn't even know that was coming out. Is that anonymous, confidential?
Totally anonymous, confidential mental health crisis services.
Okay.
It can help with suicide prevention. They can help with substance abuse disorders. So that will be essentially what SAMHSA is now offering. Will be expanded through 988 so that you can have closer reach and contact to them.
That's amazing. Thank you for sharing that. That's awesome.
Yes, it is. Overdue.
Agreed. Very overdue.
Gloria, you're muted. You're muted.
So sorry about that. It must be the eclipse that's having all these effects on us. Well, Dr. Elliot and Lucy, thank you so much for such a wonderful presentation and just, for bringing this very important topic to us, especially those that are caring for family members. And I'd like to remind everybody that is joining us, especially those that had questions regarding dementia. With the teleconnection, we offer several dementia topics throughout the year, and including some every month. And so I invite you to look at your teleconnection calendars because we do have some very wonderful, very important, informative, valuable information that, that we have scheduled throughout the months. So please look out for that. If you should be receiving your calendars monthly, that's if you register for the teleconnection online. If you have not done that, you can actually call our WellMed Charitable Foundation customer service line, which is 866-390-6491. I've actually put that number on the chat. And we can also help you get connected if you want to speak to a caregiver specialist. Even though you may be in different parts of the country, we can assist you and help you get connected to valuable resources if that's something you'd like to do. And again, that number is 866-390-6491. Dr. Elliot and Lucy, are there any last comments that you have for us? I know you shared this wonderful information, wonderful resources. Is there any last comments you'd like to mention to our participants today?
Lucy, go ahead.
Well, I just want to say, if you're a caregiver, somebody who's suffering from mental health issues, I know how difficult that it can be. So please get the support and the help that you need, for sure. And for healthcare workers, be very sensitive when you're meeting somebody with mental health issues. They can present themselves as in a way that's, it's hard to deal with, but patience and understanding, that's why we're there. And I wish you all the best. And thank you for joining us.
I want to thank all of our participants so very much for sharing your questions and your comments so candidly and your experiences. And I want to remind you again how we appreciate, on behalf of the people to whom you're providing care, all the care that you're providing. So with that, please care for yourself today. Take a few minutes and do something for yourself. It's really, really important. And thank you all again so much for joining us.
Bye, everybody.
Bye-bye.
Thank you, Elliot and Lucy. Thank you,
Thank you
everybody.
all.
Have a wonderful day.
Thank you so much.